Welcome to Mindfulness Voyage. My name is Ted Meissner. Thank you so much for being here. And as I mentioned in the previous episode, we are going to have one more on a burnout prevention program for nurses. This is incredibly important work. So I hope you enjoy today's episode. Our guest today is Kelley Strout. Kelley, thank you so much for being on the podcast. Good to see you.
Thank you for having me.
And I got to say, I'm really, really excited to be unpacking this particular topic again, because as I just mentioned before we started recording, I've had another episode on exactly this kind of thing. Before we dive into the topic, though, I'm wondering if you could just say a little bit about who you are and what it is you do and where you do it.
Sure. I'm a registered nurse and I'm a college professor, and I work at the University of Maine, which is in Orono. And for the past 5 years, I've served as the director of the School of Nursing, and I'm also a professor. I teach classes and I engage in research.
Great. And the thing we're going to be talking about today is something you have been doing on burnout for nurses. So, how did that get started before we dive into the program itself? How did this even come up?
Sure. What happened is it actually happened with my own journey. I graduated nursing school. I was super excited to work at a hospital. I thought I'm going to work 12-hour shifts 3 days a week. I'm making a great salary. I have benefits. I'm 22 years old. This is amazing. And I entered the nursing career. I worked on a cardiac telemetry unit. And I quickly realized that we had a twofold problem in our healthcare system, both with patient health and lack of preventative care, but also nurses' well-being. And I just saw nurses all around me incredibly unwell, stressed out, burnt out, and I myself became burnt out and unwell quickly. So I wanted to create a program for new graduate nurses at the time, um, to help support them and provide a better transition, a better holistic transition for their well-being. So years passed, and I went to graduate school, and then I decided to earn my PhD. And when I was interviewing for various PhD programs, I provided a proposal, Well Nurse, and it was designed to support new graduate nurses from a holistic point of view. Well, that was let's see, where are we? 2025. So this was 2009. So what's that? 16 years ago? Is that correct? Did I do that math correct?
You're asking me to
uh,
do math in my head? That's not going to work out at all well for either of us.
no. Anyhow, it was about 14 years ago, 15 years ago. And every single PhD director that I met with at was very dismissive of my idea. They said, "Why would you care about nurses' health? This is not a priority. We care about patients. We need to care about chronic disease." And at Northeastern University, where I ended up, my mentor said, "This is really important work, and you're right. We need to work on this, but um, there's no funding in this area." Hold on a second. I'm just going to shut my door. And I study cognitive health and aging, and I would be interested in having you as a student, but you'd have to study cognition and preventing cognitive decline and dementia. But perhaps you could integrate your wellness model into that. So I did that, and for years I was an aging cognition researcher, and I applied um, behavioral wellness interventions to understand how do we prevent cognitive decline in older adults. And it was a great, I had a very fulfilling research agenda in that area. Well, flash forward to 2020. I was the director of the School of Nursing. As I said, I'm actually on sabbatical this year. And the pandemic hit, and we were all living in an unknown, right? Every single day I had to make decisions with our team completely unimaginable situations. We don't have enough personal protective gear for our students. They'll have to reuse masks. Should we send them to clinical? There's a COVID outbreak at the hospital. What do we do? We had lots of communication with our risk and legal. And I never felt like it was beyond what I could handle during that time. Um, we had an amazing team. We responded to the pandemic. We were everywhere. We were responding to outbreaks, helping our healthcare partners. We were providing emergency staffing. We were training all our students well before we normally do in vaccination. We vaccinated like 12,000 people in our state, our students. But about a year in, things started to really crumble emotionally and mentally. Our faculty became very overwhelmed easily. There was a lot of crying. There was a lot of crying among our students. Nobody was happy. We're still in masks. And I remember sitting in my office thinking, I don't have the skill set for this. We're in a mental health crisis and I'm not the person to fix it. I needed a different expertise. Like I am so overwhelmed by what I'm seeing. Um, and that this was in the spring of 2021. And that summer, there was some funding that came down from the American Rescue Funds to address burnout and well-being in healthcare workers. And our local hospital reached out to me and asked if I would partner with them on a grant application. And I said, "Oh, okay." So I went to the meeting and they said, "What would you do?" And I said, "Well, I rattled off what I proposed years ago, the interventions that I had proposed." And they all just looked at me and they said, "You should write your own grant. This is a great idea." And I said, "I'm too burnt out." Because I did have a couple other grants too at the time that I was managing on top of everything else. I was like, "I'm too burnt out." And they're like, "No, no, no, you have to do it." And they said, "You apply for one and we'll apply for one." Well, long story short, I went and applied for one and they did not apply for one. And we got the grant. And that was really the catalyst for the work that we're doing now.
Yeah. And there's so much there. As many of the viewers of this podcast or listeners from previous ones know, I've been in healthcare for about 20 years, and COVID hit hard, and it's not done yet with the impacts it has had on healthcare workers. And you described this very well for people who may not be in the field, who may not have really understood how impactful that still is today. And one of the things that really intrigued me about what you're describing, and I've heard this before, is you suggested, here's how we can have a program that helps with this stuff, and just got dismissed. Oh, no, no, no. We're about this other focus without recognizing that this is an ecosystem.
Mm-hmm.
And every part contributes to the overall well-being. If your main concern is patients, their outcomes, that doesn't happen in a vacuum. It happens in an environment, and making sure that that is the best possible environment for recovery, for healing, for all the rest of it is part of what you've done. And especially with nurses, because they are omnipresent when you are in treatment for whatever it happens to be. But also the way you structured this is something to give early on in nursing career, that this can be an inoculation, a preventative measure for eventual burnout, which will occur with understaffing and the constant tensions that exist in the profession. So thank you for all of that. And tell us a little bit about what the program is and what kinds of things are in there. Again, with the note that many people may still have the misunderstanding that burnout is just one thing. And we know it is many and can show up in lots of different ways. What does your program look like?
Our program has evolved every semester based on data we collect. And we started with an analysis of just where our students are, how what is the rate of burnout among our population stratified by type of student and year in the program? What is the perceived stress, satisfaction with life, and in a wide range of health measures from steps, average steps per day. All our students had pedometers, and we had a very comprehensive battery to just kind of see, what is the health of our students. And this was the most surprising to me because our findings of this first study were very surprising because we often focus burnout on the workforce, on what's happening in the healthcare profession. And the employers are really getting the brunt of the burnout crisis. And they're getting the blame. Like, you've caused the burnout. The health system isn't functioning as it should. And that is, there's a lot of truth to that. But what was very surprising to me is that 80% of our population, almost across the board, and those percentages increase slightly over time, but our first year students, 80% were already at a high risk of burnout, first year nursing students. And in our program, 95% of our population is a traditional nursing student, which means they came right from high school, directly from high school into college. So these are 17 to 18-year-olds, and almost all of them are already at high risk for burnout. So we in higher ed are inheriting, and I mean, this is just our school. We could expand this. I mean, and there, we hope to expand our study across multiple sites. But these data that we found in this burnout are not much difference from the reports we're seeing from the Surgeon General and the state of adolescent well-being in our country. So even though it's just our site, it's not outstandingly different than what we're seeing in other data, national data. So our students are coming to us burnt out, and then they get slightly more burnt out throughout our program, and we graduate them. The majority of them are graduated at a high rate of burnout. So we're essentially sending burnt out new grads into the workforce already. And then it perpetuates. And what we see in new grad data or early career nursing data is their mental health and well-being is not good. More than 50% are reporting emotional distress, intent to leave or have left the profession. So it's a crisis. It's really a crisis. And we see it even anecdotally in our students' overwhelm and behaviors. So what we did initially, we thought, oh, well, we're going to implement mindfulness-based stress reduction. And full disclosure, when I wrote the grant, that was the piece I added that I didn't actually know what I was signing up for, because it's the most researched intervention for addressing burnout in nursing. So I naively thought, okay, the students are so burnt out. They say we don't care about their mental health. We're going to offer this intervention for them, and they're all going to sign up. Well, it didn't happen. And mindfulness-based stress reduction is a 2.5 hour program that provides participants with a range of mindfulness practices. And it's not just meditation, which is a big misunderstanding, communication strategies, noticing pleasant and unpleasant experiences, etc. Well, the students didn't have time. They couldn't do this on top of everything else. So we got a lot of pushback, and I thought, oh boy, we're going to fail. Nothing's going to work. So what we ended up doing is we ended up modifying the curriculum to a shortened mindfulness program. Actually, we use Christina Wolf's A Clinician's Guide to Teaching Mindfulness as our curriculum. And we bring our students, first year students, to campus a week before the semester starts. And this program, in this mindfulness curriculum by Wolf and Serpa, we run it over 6 days. So the program is 6 weeks, 90 minutes. We do 90 minutes, 6 days in a row. Partially as a nursing program's schedule and curriculum, it's very tight, and we don't have a lot of wiggle room for adding. So the students, all students, it's a required program, come to campus a week early. We also have a nursing dorm, so all our students are living together. Each day they start their day with mindfulness, and it's taught because part of our grant was to get teachers, 5 certified MBSR teachers. So it's taught by nursing professors or psychology professors who are qualified MBSR teachers. We actually have one teacher too who is qualified in insight meditation. Um, then that's 90 minutes. Then our students complete a mindful nutrition and eating curriculum, which is done in our kitchen on campus, and they learn to cook simple foods that they can make in their dorm rooms. And the emphasis is on building nutritious meals, but also mindfully eating them. It's not about being on a diet. It's about, paying attention to your body, being aware of how food is impacting how you feel, etc. And then we have a mindful fitness program that maximizes all of our beautiful space on campus. We're in the state of Maine. It's one of the most beautiful campuses. I may be biased, but in the country. So we have, a climbing wall. We have a flower garden. We have trails galore, the rec center, which is beautiful. And each day the students receive curriculum in space that is available to them. So it's also serving as an orientation to what is freely available to them. There's daily yoga by a certified yoga teacher. And then we also implement study strategies, time management strategies. They get a planner that's a nursing specific planner. They meet with their academic advisor. Our academic advisor runs a program that's based on Brene Brown and comparison, and they all write down something they're really nervous about, and then they crumple it up and put it in the center, and then she reads them out so that they can kind of see we're all scared. Like no one's feeling amazing about this. We all have vulnerabilities. And then they go on a tour. We have a scavenger hunt where we send them to important places on campus, like the counseling center, students with student accessibility services, which is where students go for accommodations, because we're really trying to reduce mental health stigmas, encouraging students who are coming from high school who have 504 plans, that just because you're a nursing student doesn't mean that you should get rid of your 504, because a lot of high school guidance counselors are telling students that, which is fundamentally untrue. So we're really trying to make sure our students have the accommodations they need. They visit the library. We send them to our wellness room on campus. And then after that, I developed a 1-credit course that is serving as a booster to that 6-week curriculum. And that course is the Scholarship of Wellness and Mindfulness, and it gives the students a booster dose. It's divided into small sections. We have max of 20. And each week for 14 weeks, the students come to class and we do a short 15-minute practice from a mindfulness practice they learned during the bridge week. And the course is set up as a research study of themselves. So they create a research question about their own health and well-being. They conduct an assessment, a holistic assessment of where they are. And we use Atomic Habits, James Clear guidelines around how to create a new habit, and that's all embedded in the course. And then each week they practice whatever goal they had for their intervention, and we take them through a very introductory research process of, okay, well, how did that practice influence your health? So they track their steps, their sleep, their stress scores, and then there's reflective questions too, qualitative data. And at the end of the semester, they write a lab report on their own health, and they trend all their data over the semester. It's been really powerful. And what's happening simultaneously is most of the students are living together. So I'll just say that, we had a mass shooting in Maine last fall. It was obviously very tragic. And this campus closed school one day because there was an association with the shooter who was on the loose who went to our campus anyhow. So the students were in their dorm, and they all got together in the common room and they were meditating together. So bringing them in this way also supports a culture shift because if they're all being exposed to the same intervention and then they're living and breathing it, they can all support each other on the journey. So that's the start. That's how they start.
Yeah, that is, and there's a lot there. And one of the things that stands out for me is that, as with the previous guest in the episode before this one, MBSR is a very heavyweight program.
Mhm.
And in an already a group coming in already burned out, as you shared, and already with overflowing plates, adding on 2.5 hour classes. And for those who are not familiar with MBSR, that's not once, that's every week for 2 months.
Mhm.
And you do at least 45 minutes to an hour and a half every day of
Mhm.
practice on your own, plus an all day retreat, plus an orientation. That's simply too much for an already overbooked agenda. So having adaptations that meet healthcare professionals or people in other busy professions where they live and with the capacity they have. And maybe what you're describing, and one of the things I like best about this, particularly with them coming together to practice under extreme duress,
Mhm.
is that this is being incorporated into their daily lives. That is not a separate one and done. I took this. Like, no, this is providing meaningful, practical help to me in my life. So that is all terrific. And I'm curious if you could say what some of the hurdles you've run into and what are some of the outcomes that have been happening from these programs, because you're making tweaks every semester.
Yeah. Well, I will say that another motivation to switch to an abbreviated or a shortened, modified mindfulness program for the first year students um, is that there's some evidence that because the pandemic interfered with normal developmental stages and fear and all sorts of other um, stressors, that we should be treating all adolescents as if they've been through a traumatic event. And with trauma-informed mindfulness, some of the strategies around that are shorter practices, um, movement practices, etc. So our curriculum actually aligns with a trauma-informed approach. So it was another way to kind of get around that major challenge we were seeing because we did try to run MBSR. There's a modification of MBSR that's like a 5 day, which is it's like 7:30 to 5:30, 5 days. We tried that with our first year students initially. And when we brought them the first year a week early, and it did not go over well. Interestingly, our data showed that they did have statistically significant reductions in perceived stress from participating. But in the focus group analysis we conducted with them, they said they would do it again. I loved this part. They would do it again, but they had a lot of strong opinions about how we should change it. So it wasn't all bad, but it wasn't ideal. Our data from where we're at now of everything I just described are much better. So we've found that we've seen statistically significant reductions in perceived stress and burnout from before our intervention to the end of the semester, which typically for first year students, this first year is incredibly stressful. So the fact that we're actually reducing stress is a major accomplishment. We've had statistically significant increases in mindful eating and mindfulness in general. And also, we had students who didn't participate. They just didn't show up even though they were supposed to. Um, it was 100% predictive of staying retained in the program if you participated or did not participate. So it has academic effects as well, and we're still monitoring over time. The other part is that everything you just described about MBSR and the challenge of the schedule. So Last year, I was able to get MBSR approved as a credit-bearing course for the whole campus. So there are, to make it credit bearing, there are assignments in the class. And we had to take the silent day, which was a major barrier because in MBSR, there is for those of you who are unfamiliar, there's an 8 hour approximately full silent day, which is typically done on a weekend. And just with the student schedules and lives, it was prohibitive. So we made a modification so the silent days are actually embedded each week. So there's 2 weeks where they come to class, but it's all silent, and we just broke it up to make it work. But other than that, that's the only change. And what's great about this model is that they get a taste of mindfulness and what it is in that first year. And then later they could sign up for MBSR as a credit-bearing elective later on. So they're not coming in blind, which also could be problematic for trauma-informed practices. So that's been a really good workaround for some of the time challenges that we've had. So we've now been running it. We've had over 200 students complete MBSR. And we have found statistically significant. With MBSR, we actually, my colleague who's a psychologist, she is the lead researcher on comparing those two interventions. And we used match controls. So we matched students who hadn't participated in MBSR with those who had. So there were similar characteristics. And then we tested if the intervention was, had a statistically significant effect on perceived stress, which it did, reduction in perceived stress, increase in mindfulness, and reductions in burnout for those who participated compared to those who didn't. So yeah, it's interesting because there's been adaptations to MBSR for college students, and we actually considered going in that direction, but we've found that our students are very capable, and they very much engage in our MBSR curriculum. And one of our theories behind that maybe is that because we have college professors teaching it, who are in the world of these students, it's been more effective for us. And we were contracting out initially to certified teachers who don't typically teach in that population. And it wasn't as successful as it has been with our own faculty.
Yeah, interesting. There's so many layers to this, and we're going to continue to learn more as time goes on. Kelley, maybe just one final question for you is, as you look at the trajectory of this program and the effects and the changes and the impact that it has, what are some words that you might share for those who are considering joining nursing but are a bit concerned about getting burned out? Because as you mentioned, people are coming to you already at high degrees of burnout and stress.
Yeah, it's a great question. We can't control the environment, and we can't control, the education environment or the healthcare environment. I mean, people who are in leadership positions can control that, and I have a message for them too. But we can control how we respond. And my wish for our profession is that we become more mindful responders and skilled responders and less reactionary responders, so that we can start to advocate for better working conditions and environments. And the other point I'll make is that when the seniors are graduating, I'll ask them, "Oh, tell me a patient story that meant a lot to you, or something that was, an experience that was really impactful for you during your nursing career." And they always have these just profound, inspirational patient stories. So although it's a stressful career, there are ways to reduce the stress and manage it, but it's also one of the most rewarding careers on earth. I mean, truly, there are so many career opportunities, and it's a job where you're changing patients' lives every day. So it's one of those things that with great opportunity comes also great challenge. And for leaders, I would say that while I'm very proud of the interventions that we are implementing and have been implementing, and they've been well received by students, a, a complementary intervention that I didn't discuss today is that we are also simultaneously working on course quality and everything that we're doing that could potentially be causing undue stress, systems, computer systems, technology, and it's endless work. But we can't, as leaders, think that meditation is going to solve all the problems, or yoga, or like a cake or pizza day. There are real systemic problems in our education and healthcare systems, and as leaders need to prioritize fixing them. Because until we do that, you can't meditate your way out of a bad situation. You're just going to become more aware of the dysfunction of your situation. So, I think we all can be leaders in our own way, and those with ultimate decision-making power need to listen, and recognize that very simple changes could reduce stress tremendously for the workforce, and they need it. They need people to care about them too.
Yeah. And that's been heard on this podcast and my posts every week, sometimes every day.
Yeah.
It's very ironic that within healthcare, leadership continually mistakes the symptom for the disease, and they keep treating the symptoms as the cure-all, and the disease goes on. And that's the conditions that are causing us to be overburdened in some way each and every day. So completely agree with you. Our guest today, Kelley Strout. Thank you so much for being here today. We will have links to more information about your programs. Thank you so much for being here today.
Thank you for having me.
Thank you so much for being here, for watching this very important work that's being done to save our healthcare system. Because if our nurses are completely burned out and unable to function, so does our healthcare system. And we're not lost. We're not stuck. This is not inevitable. We can make change. So remember, every moment you have a choice. Make it the best you can. And I look forward to seeing you again soon on Mindfulness Voyage.